Hey everyone, this is Ben with RegisteredNurseRN.com, and in this anatomy lesson I'm going to cover the ribs, or as they call them in Latin, the costi. Now your ribs help protect those vital organs within the thoracic cage such as your heart and your lungs, and they also assist with breathing. And don't let their long curved shape fool you. The ribs are not classified as long bones. Instead, anatomists classify the ribs as flat bones, and they are located within the axial skeleton. And together with the sternum, the thoracic vertebrae, and the costal cartilages, the ribs form what is called the thoracic cage, also known as the bony thorax. Now the average skeleton contains 24 individual ribs formed in 12 pairs, and they are divided into three main categories. You have true ribs, false ribs, and floating ribs. The true ribs include rib pairs 1 through 7, with each rib articulating posteriorly to the thoracic vertebrae and anteriorly to the sternum via costal cartilages. Because these true ribs attach to both the thoracic vertebrae and the sternum, anatomists sometimes combine those terms and call the true ribs vertebrosternal ribs. The false ribs include rib pairs 8 through 12. And like the true ribs, these false ribs also articulate with the thoracic vertebrae posteriorly. However, they do not attach to the sternum on the anterior side of the body, and instead they attach to the costal cartilage of the superior rib, except for the false ribs number 11 and 12, which are floating ribs. I'll talk about those in a second. Now, because the false ribs do attach to those vertebrae posteriorly and the costal cartilages anteriorly, anatomists sometimes call the false ribs vertebrochondral ribs. And vertebro just relates to vertebrae, chondral means cartilage. Now the floating ribs are ribs 11 and 12, and these are the last two pairs of false ribs. But unlike the other false ribs, they do not attach to the cartilage of the preceding rib on the anterior side. Instead, they attach posteriorly to the thoracic vertebrae and they float, so anatomists also call them vertebral ribs. As you look at the ribs, you'll notice that there are spaces between each rib, and that is called the intercostal space. And there are 11 intercostal spaces in the thoracic cage, which are filled with nerves, lymph nodes, arteries, veins, and muscle. In fact, when you eat ribs at a restaurant, you're eating the intercostal muscles of some animal. I want my baby back, baby back, baby back. Sorry, anytime I think of ribs, I think of that song. Now there are three main types of intercostal muscle which facilitate chest movement. You have external intercostal muscles, internal intercostal muscles, and innermost intercostal muscles. Each intercostal space is numbered after the rib directly above it. So the first intercostal space will be the space just below the first rib. The second intercostal space is just below the second rib, and so on. And these intercostal spaces are important landmarks for nurses and other healthcare professionals, especially when assessing lung and heart sounds. As I mentioned in my sternum anatomy video, the second pair of ribs meet at the junction between the manubrium and the body of the sternum, forming the sternal angle, or as some people call it, the angle of Louis or Lewis. And the second intercostal space will be just below that second pair of ribs, and from there you can count out the intercostal spaces to locate the apical pulse, which is going to be on the left side of the chest at the fifth intercostal space down the midclavicular line. And other intercostal spaces will allow you to assess different areas of the heart or the lungs. And Nurse Sarah has created videos demonstrating how to locate and assess those sounds. So I'll put a link in the description or comment section below if you want to check those out. As you examine the individual rib bones, you'll notice that some have slightly different shapes or structures on them. So anatomists categorize the individual rib bones into two main types. You have typical and atypical rib bones. Typical ribs include ribs 3 through 9, and they feature a shaft, which is also called a body, a head, neck, a groove, a tubercle, and an anterior extremity. The anterior extremity is concave and porous, allowing for the attachment of that costal cartilage on the front of the thoracic cage. The shaft or body of a typical rib is flat but long, and it curves sharply near its posterior end, forming an angle known as the costal angle, or the angle of the rib. And a groove called the costal groove extends down the inferior or bottom portion of the rib's shaft, which allows for the passage of intercostal vessels and nerves. This groove creates a sharp inferior border compared to the smoother superior border of the rib bone, and that helps you identify the proper orientation of the rib bone. So the flatter, smoother surface is going to be the top or superior portion, and that sharper edge is going to be on the bottom. The tubercle is a small bumpy area where the body meets the neck, and the articular part of the tubercle articulates with that transverse process of the inferior vertebra, and the non-articular portion is going to allow for the attachment of the ligament of the tubercle. The neck of the rib just connects the body or shaft to the head. Now the head is on the posterior end, so you'll always know that's toward the back, and it articulates with vertebrae via two facets: a smaller upper facet, which articulates with the vertebra above, and a larger facet that articulates with the vertebra of the same rib number. So for example, rib number 3 is going to articulate with thoracic vertebra 3 at that inferior facet and vertebra 2 at the superior facet. And these facets are separated by a bony crest to which the intra-articulate ligament attaches. Now the atypical ribs are going to include ribs 1, 2, 10, 11, and 12. And rib number 1 is usually shorter and wider than all other ribs, and its broad, flat surface contains grooves that support the subclavian vessels. Because rib 1 articulates with that first thoracic vertebra, there's only one facet on its head, and a scalene tubercle allows for the attachment of the scalene muscles. Rib 2 is also quite curved, but it is longer than rib 1 and not as flat. The serratus anterior muscles originate from the roughened area near the middle of this rib, and it articulates with thoracic vertebrae 1 and 2. Rib 10 has only one articular facet on its head, and then ribs 11 and 12 also just have a single articular facet on the head, but they have no necks or tubercles. Okay, so that wraps up this anatomy review over the ribs. And we have a free quiz that you can take on our website if you want to check the description or comment section below. In addition, we have a whole bunch of anatomy videos and an anatomy playlist. You can also find that in the description if you want to check some of those out. Thank you so much for watching, and please subscribe.